Hi everybody. So I'm talking today about why clinical Pilates is essential for your rehab. Many of you, I'm sure, have heard of Pilates, and most of the time when people think of Pilates, they often think of Pilates mat classes, or sometimes they think of reformer classes, those big group reformers in a specific reformer studio. Clinical Pilates is something different. So clinical Pilates is done in a Pilates studio, which means that you have equipment such as, yes, the reformer, but also the trapeze table, which is sometimes known as the Cadillac, the Wonder Chair, a variety of different barrels, and other small devices. In this environment, you are able to perform clinical Pilates in a way that is tailored specifically to the body's needs. So, difference between, say, a clinical Pilates session and a mass reformer class would be that the instructor, whether that be a physiotherapist or a Pilates instructor, is able to look at the body in front of them and tailor the session specifically to that body's needs. Whereas in a big group class, usually what happens is there is a set choreography or a set routine, and sometimes really good instructors are able to tweak things for different bodies, but generically the system is set up that everybody is doing the same thing. So in clinical Pilates, we're really looking at the body in front of us. Does it have any injury history? What are its goals? Does it need to be able to move more freely in certain areas? Does it need to strengthen certain areas? Does it have a particular, what we'd call passive integrity structure problem at a particular area? And then the session is very specific towards these goals. Now, why is this so important in rehab? If you've heard me talk before about the 3 stages of rehab, so just as a quick recap, you've got the first stage, the acute stage, the second stage, the subacute stage, and the third stage. It's in this third stage where this clinical Pilates is particularly helpful, because if you're able to really break down the body and understand what caused the injury in the first place, then in that third stage of rehab, once all the pain and the swelling has gone, you're able to really work on the nuts and bolts of that movement and make sure that you've fix, strengthen, correct whatever those patterns are or weaknesses, and ensure that that injury doesn't come back and haunt you in the future. So if you are not participating in some form of clinical Pilates, I really encourage you, especially if you're someone who seems to have reoccurring injuries, or you have the same injury or injuries that pop up in different places, chances are it's because you're not completing this third stage of rehab. And one way to do that, I think, in a very enjoyable fashion, is to get yourself into some kind of clinical Pilates. So I hope that was helpful. As always, if you have particular comments, you can make sure, or you can pop them down below, and we always make sure we get back to those comments. If you want some information or advice that's more specific to you, feel free to give the girls a call. We've got studios in Caringbah, Alexandria, and Holster Park, and our team of highly qualified physios and Pilates instructors would be very happy to help you if you've got some specific questions that you'd like answered for you. All right, I hope that was helpful, guys. I'll see you again soon. Bye.